Good morning, everyone. My name is Jennifer, and I want to talk about a total shoulder arthroplasty, which is a surgical intervention for osteoarthritis of the shoulder, which is specific to the glenoid of the scapula and the head of the humerus, with the rotator cuff still functioning or repairable. There's a number of risk factors that could lead to osteoarthritis of the shoulder, such as work, recreation, daily overuse, and poor posture. During a total shoulder arthroplasty, the head of the humerus is replaced and a cup will be placed in the glenoid of the scapula. The subscapularis will be cut and reattached later on, and having functioning rotator cuff muscles is necessary to create stability within the joint. Anterior dislocation is a big risk factor during post-op, and it's important that the patient wear a sling and keep their affected arm immobilized, as well as avoid any external rotation, any extension of the glenohumeral joint, as well as keep the affected arm non-weight bearing. An impairment at the activity level of the ICF would include dressing normally, so this would be specific to like putting on a shirt, which would need to have altered modifications since the patient's supposed to remain immobile, avoid external rotation and extension of the glenohumeral joint. So today I'm going to show you how to put on a shirt if you have a total shoulder replacement. Alright, so if you were to put a shirt on normally after a total shoulder replacement, you'll be violating some restrictions. I'll show you how. So I might do this in an exaggerated way. So say my right shoulder was the one I had my shoulder arthroplasty on. If you go to put on a shirt normally, you usually kind of stick your arms all the way through. Well, this is external rotation. Pull it over your head. And when you go to pull it back, you're doing extension of the glenohumeral joint. This is also not allowed. And you're also supposed to keep your surgical arm immobilized and wear a sling for most of the time. You can take your sling off to put on a shirt, but I'm going to show you a way to put on a shirt without violating any of these restrictions. Alright, so after a total shoulder replacement, you're going to have to modify the way you put on a shirt. So the way I'm going to recommend is you find either a chair to sit in, could be like a desk chair, it could be a kitchen chair, and you either use the side of your bed or use a table. That way you're going to keep this surgical arm immobilized, and it's going to help avoid any external rotation or any extension. That way you're following all of your post-op rules and precautions. So the first step is you're going to take your shirt, lay it out flat on your lap best you can, and you're going to use your good arm. You're going to find the armhole for your surgical arm, and you're going to slide your hand through it, and then you have to slowly work it up your forearm. And then once you get to your arm, you're going to pull it up as high as you can. You're going to pull it across. Find your good armhole, slide it through, and then find the head hole. Take it, pull it up and over. Make sure you don't lift or do anything with this arm. Keep it immobile. And then you pull it down with your good arm. And then you fix your sleeve. If you have long hair, you can pull your long hair out now. And then you would want to put your sling back on and you're dressed.